Hi, sorry folks, I do not know what happened there. I mean, I hopefully Joss is hopefully going to come back to me in a minute or two and we will get back together. Sam Roberts asked a question, and Sam, I have lost that question, but I am going to try and find it if I can. It was something to do with children. So let me see if Jocelyn, right, okay, let me see, this hopefully should work again. Hopefully Jocelyn's just about to join me again and we will not have that hiccup. I knew the weather was going to, well, I'm blaming the weather. It's the fact that Growing Smiles happens to be. Hello.
Hello.
Hello. We were
Hi.
doing so shit. I do apologize. Listen, Jocelyn, we had a question from Sam Roberts about children, and I just caught my eye about the children, and I'm trying to see if I can find the question. So bear with me. Or, Sam, if you've rejoined us, please ask your question again, because I was really, really pleased to see that you were mentioning children, because there was something I saw recently, and I actually copied and pasted the notes of it and meant to go back to it, about the number of children with cancer and how they're looked after in mouth care with them. Now, I know when I was still working in hospital, we used to go to the children's hospital and see some children. And it's really difficult because parents do want to do the right thing when they've got really poorly little ones. But you know, what can parents do as far as their child's oral health goes, you know, in the situation where oncology is concerned, Jocelyn?
If they're able to brush the teeth, fantastic, fantastic. Try and brush the teeth. If not able to use the swabs, then try and use those. There's also the water jets as well. So
Mm-hmm.
that's a way of being able to flush away debris or to just keep the sluffiness that might occur during treatment away. So I've got some as well. What have you got, Lee?
I've got one
Lovely.
of the water picks. Yep,
Water pick. So
yep, water pick.
rechargeable,
Yep, rechargeable
cold
one.
water. So you
Yep.
put the water in the back
And
like that.
there's,
There's that
there's
one.
actually there's a kid one of these as well. There's a little nano unit, which but you need
Oh,
yeah, you need a 2-pin socket for it. But I remember one of my kids had it when they lived away from home, and what they did was use the 2-pin socket into the 3-pin adapter and used it in the
right.
sink. So it can be, but it's one of those things that kids can actually do for themselves. The nice thing about the unit with the 2-pin socket is there's a cable from this, so you don't have the whole bulk. You just literally have this on a cord. It's you know, and it does make it a lot easier to use. Kids quite like it because they can sort of have a bit of fun with it. I never told you that it could be used as a water pistol, but it can. And
Yeah,
that's the Philips one. The
that's the
Jocelyn's
Philips
got
one,
the.
so the original and the new one. So again, you can put water or mouthwash in the back, so that feels great. Again, it charges up at the bottom. You have like the mouse mats at the top, so that squirts when you need it to. So you can choose on this one if you want 1, 2, or 3 squirts. A very good water pistol. But they are great for getting into the nooks and crannies. They've got slightly different tips on as well, so you can get into those areas. If you want something more powerful, say, and you do have a charging point, then there's this one. So this one you can choose the power on and off. You've got the button, obviously the removable tips there. You can put the water reservoir there, and you need a charge point. So there's lots of different ones. Panasonic do one, lots
Yeah.
of different ones. So they're a nice option. And if they're not able to swallow, then you might need to use the suction. So there's different suction options in hospital, and potentially you can use those at home. So it's just trying to keep the mouth fresh, keep the food debris away, keep the mouth moisturized, lubricated, help with food, obviously, and drinking and
Yeah.
speaking. But for children, it's very hard. So it's just
I'm
trying to make
just
it
trying.
easy.
Yeah, I know. This is the thing. And also remember, if you've got sensitivity, put warm water in it. Really, really, it makes such a difference. Hold on, I'm just trying to find Sam's question here. We became very pixelated there. Did you know that you've been pixelated? Yeah, sorry about that, folks. Anybody that lost us there. I'm just trying to find Sam's question here. So bear with me here, see if I can see this. Yeah, hold on, because she'd asked this about children. So bear with me a wee minute, Sam. Sadly, children are affected too with cancer. Is the paste used to be different than adult paste? To respect the fluoride in respect of the fluoride content. Sam, what I would say is it depends on the age of the child. And particularly if their mouths are dry, they're going to be increased risk of tooth decay. So you want to be using a fluoride toothpaste with at least 1350 parts per million of fluoride in it. Now, you also want something that is not going to irritate. So something that's non-flavored can be really useful. So some of the Oral-Nurse ones and the Oraleve, I have got the Oraleve as well. So we're both in the same wavelengths there. But those are probably your best, Sam. And the thing just worth noting, if anybody is talking about this in relation to the under threes, the 0 to 3 Oral-Nurse at the minute has not been available for quite some time. Now, it only has 1,000 parts per million fluoride in it. And generally speaking, the Public Health England, the recommendation is at least 1350 for anybody that gives concern. So that means anybody is increased risk of tooth decay. So yes, use the 4+ one of that. It's got a cute wee shark on the pocket. It's a red box of the Oral-Nurse like that. But yes, Sam, great question, because it is a worry for parents. You want to do the right thing, but you also want to make sure your child is keeping as well as they possibly can. So I think the rest of them, I'm just looking to have these bees. Yeah, Evelyn has also said SLS free and flavour free toothpaste for 1450 parts per million children and adults with mucositis. And again, that is, you know, we've got a number of these. We've got the Oral-Nurse, which is SLS free. It's got fluoride. You've got your Oraleve. You've got a Biotin toothpaste, which I'm trying to see if I've got it here. And you know,
there's also Zero Storm. That's a nice one. Yeah. We've also got Enamelon. It's a nice one.
Yeah, I've got Enamelon, and I've got Biomin here as well.
Yeah, Biomin. So, fantastic.
Yeah, Biomin. So we've sort of pretty much, we've got you covered. The things about what you find, I mean, the Grow and Smile shop, just to put this in context for any of you, the Grow and Smile shop was never part of the original plan. Grow and Smiles was started to help people try and help themselves. So in other words, as Jocelyn said, you know, less than 50% of the population go to the dentist regularly, you know, and for a whole lot of reasons. But there's an awful lot that we can do for ourselves on a daily basis at home. And what I found talking to clients and people we were talking with online is I was buying products in that they wanted. So some smart person, Andy Hill to be particular, when you know somebody who's totally non-dental, said to me, Leigh, why don't you have an online shop? And we know, I think we've just actually, we've been doing some stock things, and I think we've 140 something odd products in the shop. What you want to know about is anything that we keep on the Growing Smiles shop is there because it passes muster with me. So in other words, it will have a benefit to there. It's not just something, selling something for the sake of selling it. It's there because I and colleagues and people who I respect, and the scientific evidence base shows that it has a benefit to people's oral health. So, you know, you can be rest assured what you're buying from us is legitimate stuff, because sometimes I see things sold on eBay and Amazon considerably cheaper than we can even buy it from wholesalers, and I'm always wondering what actually is that. But as far as Sam was saying about and Evelyn was saying about the fluoride toothpaste, you know, you've got a number of options there that are sodium lauryl sulfate free. So that's SLS. Sodium lauryl sulfate is the foaming agent in toothpaste, and it can irritate. So even if, I mean, you know, you don't even need to have a problem with cancer. If you suffer from ulcers, using a toothpaste which is sodium lauryl sulfate free can actually help. So it's worth remembering that. Have you anything else to add there, Jocelyn?
I was then going to talk about tooth mousse and MI paste, actually.
Yep, brilliant. Yep.
Because it's a great adjunct. So it's something that you can add into your routine. So if you have a dry mouth, whether it's for a tiddly, so lovely Leigh is showing you tooth mousse and MI Paste Plus. So they're slightly different. So the MI Paste Plus has got fluoride in. They're both made from they've got calcium phosphate in, which is what your saliva produces and contains, that helps to reharden your teeth. So it sort of boosts that response to be able to remineralize your teeth. It's so easy to use. For little ones that might be eating a lot of fruit, or cancer patients, you can put a little blob on the finger, on the end of your tongue, and then just wipe it around like that. So for some of our head and neck cancer patients, they might have something as simple as what Leigh's showing you there. Very easy, simple thing to do. Comes in 5 flavours. Do you hold 5 flavours? You've got the 5 flavours, yeah. So got
We have all 5 flavors. Yep.
strawberry.
We also have their strawberry, vanilla, tutti frutti, mint, melon. Is that 5?
Strawberry, tutti frutti, melon, vanilla, and mint.
Yeah, that's us. We've got all 5.
Cool.
Yeah, and
so
go on
not
ahead.
everything needs to be minty, so it's nice to have different options in different flavours. So calcium phosphate is actually becoming more common in some toothpaste and things like that. So the Biomin toothpaste has got calcium phosphate in, and so is the Enamelon. So it's another option. There's lots of options out there. Try the different tastes. We want the toothpaste to be as smooth as possible. So there's abrasives in all toothpaste, but we want them at the right down at the low end of the scale, so they're not overly scratching the teeth. But they work. They work. It's something that's added into toothpaste. So that's an option. The other thing I was going to mention was...
Sorry, Jocelyn, I was just going to say, Toothmousse and MI Plus paste, 0 to 99, any age group can use this. The only thing you have to be careful of if you've got a casein allergy, and casein is a milk protein. Now, I have people who are lactose intolerant and gluten-free who manage this, but it is worth, you know, just having a check if you're not sure. But these are great products, and while they're expensive, they go a long way. And I always tend to think of them as like a moisturizer for your teeth. So where you would wash your face, then you would moisturize. So you brush your teeth and then you moisturize. So you put that on just before you go to bed. It's a great thing to put on kids' teeth. If you're back to the children's thing, that if you're going to read them a story, Toothmousse on, you try and keep that in your mouth while we have a story. And it's a great snuggle time.
Bedtime routine, absolutely spot on.
Sorry, you were going to mention something else, Jocelyn.
Oh, just that there's lots of different gels and sprays and things. So it's all about application of those things. A lot of people tend to just put gels and sprays on the end of their tongue and expect it to do what they need it to do. Yeah. With the gels, you need to actually move it all around. Great. Yeah, got the GC dry mouth gel there. Again, 5 flavours, pH neutral, which is great.
Yeah. Again, there's a little tiny blob. You don't need very much. Oh, put it in the right place.
And get it right around all those tissues. And you don't need very much, and it really works far better that way. So it's all down to taste. And it's quite jelly-y, so that's nice. So you've got the Orally, Bio Extra. So many different types of things out there. People always try and find something new to help lubricate that mouth.
Orally. The other thing that's worth noting is, I don't know whether you've seen this, this is the dry lips. This is really, really good if you are getting dry, cracked lips for whatever reason. But sometimes when your mouth is so dry, your skin around your lips, you can get little big cracks at the corner of your mouth, and it can be really, really painful if you're using CPAP machines. Again, that is actually really, really good for dry lips. So there are lots of options. We actually have, I think, we've just changed some of the stuff around in the online shop, and we have a heading for dry mouth products. So all of those should be in the one place, but if you can't find it, shout, because I've probably moved it when I shouldn't have.
With our head and neck cancer patients, they'll be also warned what they can and can't use on their face and around their lips because of certain treatments and how things work better. So those specific patients will have information what they can and can't use. So but lovely lip balms. The lip balms are great. The other options also.
What about chewing gum, Jocelyn? How do you feel about chewing gum?
Pick those up.
What are we like? I really begin to think that we've been cloned.
Glasses, it's all happening.
I know, it's probably freaking everybody out now. But anything that stimulates saliva flow is a good thing. So yeah, anything that simulates saliva flow, anything that is going to make the mouth more comfortable, that is going to allow you to eat properly, it's going to allow you to chew, it's going to allow you to talk, it's going to allow you to smile. It'll also help keep your breath fresh, and
Yeah,
that's a biggie.
halitosis is a problem that a lot of patients complain of. So about
Yeah,
keeping the mouth as clean as possible, try and keep the lubrication in there. These mints that Leigh was just holding up at the same time I was are different ones
yeah,
made from xylitol, so they're great. So yeah, we've got the xylogel there as well.
yeah,
Great, great, great options. So many things out there. Ultradex, absolutely. That
yeah,
comes in a mouthwash that's flavour free as
yeah,
well. So if you're not mind on mint, some patients say that some specialists say that some cancer patients don't like mint. I've tried
yeah.
everything with everybody, and they soon tell me what they do and don't like.
Yeah.
So
The Xylomelts also come in mint free, by the way, which not everybody realizes. You know, so
in
they come
America,
in
they've
regular.
got the cinnamon flavour. So that
Yeah,
might be
I
coming
might,
in soon.
might
Who
pick
knows?
some of them up while I'm away. They also have a Xyli gel now, which is the same basic principle. You know, there's mouth rinses. I mean, there's so
Yeah.
many options now. You shouldn't have a problem. Cleaning your tongue, though, I mean, it's hard to beat a tongue scraper. So, yeah, really, really useful. Lots and lots of products there to help people. I'm just looking to
Mm.
see if I've missed any other questions here. So bear with me a wee second, please, Jocelyn. And then I think we probably should let you go, my dear.
That's
Yeah,
right.
we'd frozen, we were doing really well, and then we sort of went, we sort of ended up freezing, unfortunately. We became pixelated, which was not pleasant. I don't know about you, but I didn't really like being pixelated so much. Anyway, listen, if there's any other questions, I'm going to be here for a little while. Jocelyn, just to finish up, because you know it's 8:10. It has been way past our bedtime. I just would really like to thank you on behalf of Growing Smiles. You
Thank
have been
you.
super first guest. I'm sure everybody is a lot better informed. It will be interesting to watch the recording, because we're going to leave the recording up on the Facebook page, and I'm going to put links up to it, and let other people know they can go back and see it, because some people don't realize that all our videos, all apparently 300 odd, are still hanging in the ether on Facebook.
Wow, well done.
No,
That's
apparently
amazing.
so, yeah, yeah. So you sort of people have to give me a bit of a Bible when I waffle. Um, but just to summarise, what would your top tips be for before, during, and after cancer therapy? What would your top tips be?
Okay, so before, start with a good routine. If you're not already in a good routine of brushing twice a day with a fluoride toothpaste, please start. If you can start and use something between your teeth before your treatments begins, please start. Try and get the bacteria in your mouth as low as it can possibly get your mouth as healthy as possible. Visit the dentist, have a checkup, try and complete any treatment. If there are extractions to be done, they will give you a timing of when they can then start the treatment for cancer afterwards. So that they'll talk to you about that. During treatment, always speak to your oncologist and ask when you come to the end, or during, if it's long-term palliative or long-term treatment, when can you see your dental team, and they will tell you when to come and see us, so you're not making a wasted journey. We want to see you, we want to see how you're getting on. Definitely after you've finished your treatment, ask how long it is then for the patient or for yourself to be able to come and see back and see us, and we will carry on and we will look after you. If there's been any damage to teeth because you've had to eat and drink anything you possibly could, then we'll sort it, we'll look after you. And if there's any toing and froing back to oncology, we'll work with you and we'll help you all the way. So just about keeping the mouth as clean and healthy as possible. So I hope that helps.
I'm sure it really does, and certainly, I mean, I've learned bits tonight, and I mean, it's been really, really worthwhile doing this. So, thank you very much for being our first
Thank you
guest.
for inviting
You
me.
are, oh no, I mean, it just was a match made, really, wasn't it? But I mean, look at the glasses thing. I mean, you can't not have this together. I mean, it was just me. So, unless you've got glasses like mine, you're not in, folks. It's as simple as that. No, I'm only joking. We are going to look at more guests, and it is something I think we will include on a more regular basis. But I do think
Fabulous.
this has been a brilliant topic. You have been a fantastic ambassador for mouse care. Um, just remind us of your website where people can find more information. I'll put the link up anyway on ours, but just tell us again your website just so people know.
So my website is www.mouthcareforcancerpatients.co.uk. I'm on Facebook, Twitter, Instagram. Ask me any questions. If I can't get back to you straight away, I will try as soon as I can. Ask me any questions. If I don't know the answers, I will certainly ask people that I think will know the answers and get back to you. So thank you very much for inviting me, Leigh. That's fantastic
Thank
night.
you very much indeed. I mean, it's been absolutely great. I mean, I hope people who have watched have found it beneficial. Anybody that's asked a question that for some reason we haven't answered, I'm going to have a wee look through them, and Jocelyn maybe have a quick look as well and see that we make sure that you've got the information you need to have. And we're always, I mean, Jocelyn's extremely active on social media. I do my bit. Facebook, I'm reasonable at. Instagram, I'm sort of getting hanging up. Twitter, I can't get my head around, but I think that's an age thing. But anyway, what we'll do is we'll make sure everybody's the information. We'll put some links up here. Please join me. I'll be back here, same place, same time next week. We'll be back to 7 o'clock next Thursday. I haven't a clue what it's going to be next Thursday, but I'm sure I'll think of something. So listen, Jocelyn, thank you ever so much. Have a lovely evening. Go put your feet up, and really, really appreciate you helping out tonight. Thank you.
Thank you, Leigh. Thank you.
Bye. Bye.
Thank you.